Hi, my name is Qiang Cai. I'm a professor of medicine at Emory University, Atlanta, Georgia. I also direct an advanced endoscopy fellowship in our institution. I appreciate the editorial office in gastrointestinal endoscopy giving us this video interview on our paper, Short-term outcomes of double pyloromyotomy versus single pyloromyotomy at peroral endoscopic pyloromyotomy in treatment of gastroparesis with video, which is accepted and published online in GIE recently. As we know, the original peroral endoscopic myotomy, called POEM, is an endoscopic procedure for therapy of achalasia. Gastric peroral endoscopic pyloromyotomy, called GPOEM, is an endoscopic procedure for treatment of gastroparesis. POEM has been performed for the last 10 years, and the GPOEM has been performed for the last 7 years in the world. Routinely, only one myotomy was performed during the procedure, either in POEM or in GPOEM. In general, more than 90% of patients with achalasia will get much better or better after POEM, and about 70% of patients will get better after GPOEM. Therefore, both POEM and GPOEM have very good results and have been performed more and more in taking care of patients with achalasia and gastroparesis. But one problem is the recurrence. Some patients' symptoms recurred and become sick after certain time post-procedure, which can be a few months or can be a few years. Then a second POEM or GPOEM have to be performed again. To do a second POEM or GPOEM, it takes lots of efforts from physicians and also from patients and their family. Basically, we have to start all over again. Based on this observation, my thought was that if we perform double or two myotomy in the index POEM or GPOEM, we may avoid or reduce recurrence. A few years ago, I started performing two or double myotomy instead of one or single myotomy at the POEM or GPOEM procedures. In this study, we compare the short-term 6 months outcome of a double myotomy with single myotomy at the GPOEM for patients with refractory gastroparesis. The result showed the double myotomy was better than single myotomy. However, I have to point out our study had a limitation. It was not a randomized study. The single and the double myotomy was not performed alternatively. Also, the long-term clinical efficacy is unknown at this time. Anyway, our study showed the clinical success was higher in patients undergoing double pyloromyotomy compared with single pyloromyotomy in this non-randomized short-term follow-up study. And also, it was safe to perform double myotomy and did not add too much time to perform it. In the future, randomized study and long-term follow-up studies are needed. Thank you.